I'd like to welcome you to another edition of the Beacon Hill Buzz. Marian, how are you doing today?
Just fine, Senator. Thanks. I'm happy to be here.
What exactly does the work in your office entail? Is it just prosecuting cases, or is there more to it than that?
It's much more than that now. You know, when I started in the DA's office, we very much opened the doors in the morning, and the cases that came in, we did the prosecution of that. That is obviously still our core mission, the protection of the public safety. But so much more of our work is focused on both prevention. Obviously, it's much better if people never have to meet us. And then in looking at ways to deal with some of the cases that come to us through a diversion program or something else, particularly for young offenders.
And you've recently spearheaded many pieces of legislation aimed at reforming the criminal justice system. And one bill that you and I have both have partnered on has been an act prohibiting gunfire directed at dwelling houses, which will discourage people from doing so by, I think, changing it from a misdemeanor to a felony. Can you talk a little bit about that?
Sure, and you've been a wonderful partner on this because, and in fact, Lowell has been affected by a lot of this. I think most people are surprised to learn that right now we don't really have a statute that punishes in the way we should that really fear-inducing crime of people riding around either on bicycles or in cars spraying houses with bullets. And unfortunately, I think if you look around the city right now, and especially at busy intersections, you see a lot of houses with those bullet holes.
Yeah.
And we can sometimes charge that as some kind of malicious destruction or that sort of thing, vandalism, but that doesn't really reflect the seriousness for the people either who are living there and are inside the home at the time. We've been incredibly fortunate. You know, we've seen even here in the city bullets coming right past people who might be lying on their own couch or going into children's rooms, that sort of thing, or even coming home and finding, for instance, your door sprayed with bullets. And this proposed bill would really speak to that. In those cases where somebody is doing that either as pure vandalism or very often it's done to send a message to somebody in the house, it would allow us to prosecute that as the serious kind of offense it is. You know, I think when you look at places like Lowell who have done so much to really bring the city back, to establish good, safe neighborhoods, these are the kind of acts that cause people to be afraid to leave their kids outside, make them think about, we've had people tell us, that makes them think about leaving because you have a bullet come in through your bedroom or your living room. You're not going to want to stay in that house. And that's why that's so important to do this.
Yeah, and I think we've been very lucky so far that it hasn't resulted in a terrible tragedy. But I do remember that when I was preparing the testimony to testify on that bill a couple of years ago, I talked to the Lowell police chief, and he told me that there were within a 5-year period, which would be 60 months, there were 90 cases of that, which is 1.5 times per month. That's incredible. And in conversations that I've had with other state senators from other gateway cities, it's a problem there too. But you know, hopefully that legislation will pass soon if you and I keep working on it.
Right.
Would you say that most of the weapons used in instances of gun violence are registered, or are they what you might call ghost guns?
Increasingly, ghost guns are really a problem. And for people who aren't familiar with them, ghost guns are guns that you purchase a kit where the gun is manufactured to 80%, and then you create the other 20%, usually using something like a 3D printer. So those guns, because the selling of the kit is not a firearm, it's not covered by the really very effective laws that Massachusetts has about the selling and transfer of guns. So I can go online, I can order that gun kit, have it delivered to my house, make the other parts of the gun. I now have a working firearm, and it is not only not registered, but it's completely untraceable because it has no serial numbers. So I could commit a crime, leave the gun right here on the table, and we wouldn't be able to use it in any way to trace it back to the person who committed the offense.
You recently had a very interesting panel with U.S. Senator Ed Markey. How does your role as district attorney relate to the issues of toxic chemicals in our community?
So we had an environmental justice summit really looking at some of those forever chemicals that we're seeing in our water. And two pieces that really tie into our work. The first is we know those chemicals are most dangerous to either pregnant women or young children. And just sort of as the COVID affects everything, but one aside in how this has become even more dangerous, ingesting those chemicals in water can cause very significant developmental delays in children. And as everybody has probably heard, during COVID, there's been a real short supply of baby formula. So often people who maybe don't have the resources or haven't been able to find the formula are stretching a can of formula a little bit by adding more water.
Right.
Now, obviously, if the water's got the forever chemicals in it, that's making it worse.
Right.
There's also a very significant link between those chemicals and cancer. And I know we say that a lot about different kinds of things, but the most profound link there is to pancreatic cancer. And unfortunately, as we all know, there's usually not a good ending. That's
Right.
not a very treatable condition.
Right.
So we're really looking at, we want kids to go to school, to do well, to get jobs. All of those developmental delays and things that people can suffer as a result of that, that's a problem. We know that, for instance, many times people will, if there's a water issue, the thing that you're told to do for safety is to boil that water. If you boil water with forever chemicals, you actually make them more potent. So especially in under-resourced communities where the filter that you need, which costs about $300, is beyond reach,
Right.
people are going to boil that water. It's like the formula. They're actually making the problem worse. So we really wanted to get that message out, and Senator Markey had been part of getting a very large amount of money into the infrastructure bill to help communities. There's now a provision of that communities can apply for grants that they can use in a variety of ways. One of the ways we're recommending is to give people vouchers at some certain poverty levels. Give them a voucher so they can get that filter so that their water will be drinkable in their house.
I was with Senator Markey and some other people a few weeks ago at the university. The university just got a big grant, federal grant for to have home tests, so that people would be, when they're done, and I think it'll be several years, but eventually there would be a home test that people could have to test their own water for a variety, arsenic and a variety, lead and a variety of other things as well. How does your office plan to address the issue of toxic forever chemicals in our communities? And what other agencies do you plan on working with to do so?
So we are working with local boards of health to, first of all, get information out, and then to help them make the best decisions for their communities about what kind of grants they're applying for, how they're going to be using that. We have a Safe Babies, Safe Kids task force, which focuses on kids from pregnancy through college. So we're spreading a lot of information, working with the hospitals about making sure that when you're bringing your kids in for either prenatal visit, you're going in for a prenatal visit, or you're bringing your kids to the pediatrician, you're getting all of that information.
Yep.
What's most effective, what kind of food, for instance. One of the experts we had talked about how fruit juice, which sometimes kids are drinking way too much fruit juice. That's a real problem because it enhances the chemicals they may have ingested from somewhere else. So there were some recommendations about what kind you should be using, that sort of thing. So we're going to be working very hard with the hospitals, with the public health departments, getting that information out.
One of the things that's been in the news a lot lately is are hate crimes. Since creating the Anti-Hate, Anti-Bias Task Force, have you noticed an uptick in hatred-related incidents and crimes? And is this because there's more attention being brought to the system as a whole, or because there's simply more incidents of hate crimes occurring?
We've had a very dramatic increase, and I think it is a combination of both. I think we've really been sending a message, which I'm happy to see people taking, about reporting things to us. We have a form on our website where anybody who is either the victim of or who witnesses some kind of hate crime can report that to us, either with their information or anonymously. And we're really tracking that, with a map of the county of where we're seeing these things. So I think there is more reporting, even of the things that may be sub-criminal behavior, but are still incredibly painful and really affect a community. The second is, I don't think it's any secret that people feel much bolder about using this kind of language, doing these kinds of things. It's very frequent now that in the midst of what would normally be sort of a little traffic, scuffle, if you will, it now becomes a hate crime. One of the interesting things is we've seen an enormous number of hate-related incidents in places where there's food. We've had a lot of these incidents happen in the grocery store. We've had them happen at orchards and farms where people are. I don't know whether that's because people maybe are frightened or frustrated by what they're spending themselves. And that sort of triggers something. Recently, Massachusetts, and this is a time when it's not good to be in the top 5, but Massachusetts was named number 2 in the country for the states with hate incidents where people are putting out some kind of flyer or saying things. So we're working very hard to address that. Okay.
And how do you handle instances of hate crimes or of hate in a community when there's not a crime?
So we've tried to use some remedial measures, whether it's sort of a town hall forum that we've moderated usually with the local officials, elected officials, to sort of talk through what happened, to give people the facts about what happened, because a lot of times when people don't have the information, stories kind of spring up to fill that vacuum. So to the extent we can, getting the accurate information out there, what has been done about it. Sometimes people feel like nothing happened. What actually has been done, what the results were of what was done. We've used some restorative justice practices in communities to, if we have been able to identify, for instance, somebody who's responsible for the harm, to kind of bring people together to really understand what that means. You may have a situation where really hateful words or symbols appear on buildings or in a school or something like that. People need to take responsibility for that, and there needs to be some education about why that's hateful. I think sometimes there are things, especially with younger people, they know something is not a good thing to write or to put on something, but they don't really know why or how harmful that is.
Right.
And we've tried to use that education process as well.
Right. Okay. So you mentioned that the role of district attorney goes far beyond the courtroom. Here in Lowell, you've launched many innovative prevention initiatives, one of which involves free oral health to underserved children and will impact their academic performance. Can you speak about that?
Sure. We became aware of, a couple of years ago, some research that indicated that kids who are disciplined in school, and on that range of discipline from, they're sent out of the classroom, they're suspended, maybe they're expelled, almost 80% of those kids had never had good oral health care. So frankly, they're in pain a lot of times. And I think, for the viewers, if you think about any time you've had a toothache or you've needed to get something done, and as an adult, excuse me, that's probably a temporary problem and you're just waiting to get to the dentist or whatever. With kids, they probably aren't eating right, they're not sleeping right, and they're not playing well with others because they're in pain.
Right.
And lots of times, even if you have some health insurance, it probably doesn't cover that preventative dental things.
Right.
So we've partnered with school districts, and Lowell has been one of them. And as well, we've partnered with colleges and universities that are offering dental hygienist programs. So we have a sort of 2 options. Sometimes the hygienists go to the schools and do the preventative kinds of things that kids may not be getting, fluoride on their teeth, cleaning. We are working to build a network of dentists that will be able to refer kids to for more advanced things that they need. We're focused on the 2nd and 5th grades because that's when kids should get that preventative kind of thing done. And sometimes we bring the kids, we have a partnership with Middlesex Community College. We bring them over to the really nice facility that they have right downtown. The kids love it. They come over, they get some education about good oral health, about what are good things to eat, all of that. They get a bag of toothbrushes and floss and all that, and then they get some preventative work done.
Toured that that dental clinic, I
beautiful.
guess, over there. It
Yeah.
certainly is.
Yeah.
And it's centrally located right downtown,
Yeah.
so it's accessible to everybody, really.
And they've got nice space for the kids that are waiting their turn or finished to kind of be, working on little projects about good oral health and all of that. It's a great facility.
Yeah. As district attorney, you also serve as a training resource. And I saw that you recently launched a new training for mandated reporters. Why is providing thorough yet simple mandated reporter training so important?
Well, because many professions, nurses, doctors, teachers, all of the people that are interacting with kids in their professional capacity are required, if they suspect abuse or neglect, to report that to the Department of Children or Families. But that's not, obviously if a child comes in and they have physical marks on them, that might be pretty clear cut. It's often much more subtle than that. And we want people to be able to fulfill their obligation, really understanding what they're doing. And obviously that's changed over time as well, as the number of reporters has grown and the conditions to be reported has grown. And most importantly, many of the places that employ the people who are mandated reporters have either lots of turnover or they have people who work different shifts. So for instance, at a hospital, nurses are mandated reporters. Well, you have probably at least 3 shifts of nurses that work during the day. It's hard to train all of those people. And if you did the training last month and I start this week, well, we don't want me to wait another year to get the next session of that training. So we partnered with the Attorney General's office and we've created a statewide training that's available online for mandated reporters. It's regularly updated as the law changes, as medical practice changes. So places that employ mandated reporters or anybody in the public can go on our website, look at that training, they answer the questions, and either they get the question right, or if they get the question wrong, it's explained to them why that's wrong. And at the end, they get a certificate that they've done the training, and they can give that, their employer can keep track that everybody on their staff is trained. So I think for anybody who's curious about that, that's a great resource.
Your office has some initiatives coming soon to help young people detect misinformation online. Do you have a broad sense of how this will work? And will it be online training, in-person assemblies? How dangerous do you believe online misinformation can be to our young people?
I think the misinformation is an incredible danger for a few reasons. First of all, you think about kids and the average time they're spending online, which, the average people will tell you, the research will show is 7 or 8 hours a day. Kids are online in some way. And so that's a lot of time.
Yes, it
and
is.
It's an incredible amount of time. And I would say that's probably low.
Yeah.
And then when you think about, and right now the research shows that 86% of people, and this is everybody of all ages, gets their news from some device. And we've seen the kinds of things that can spread online. The pandemic was a perfect example. The crazy things that were spreading, and people weren't necessarily recognizing them as crazy, of how you could prevent COVID, what you should be doing, that kind of thing. We have seen at least a few times, beginning with the Pizzagate scandal down in DC, how people see something online and it leads to real crime. Just last month we had the man out in, I believe it was Minnesota, who killed his wife and daughter because he really had gone down sort of a rabbit hole of some crazy conspiracy theory about families that he'd been following online. So we want kids, well, we want everybody, but we're starting with kids, to be able to think when they read something online, who's putting this out here? Is it accurate? What should I know about this? And teaching them really critical thinking. So we have we partnered with a group that had been developed at Stanford. They have a curriculum for teaching kids how to really be good consumers of news online. How, for instance, to read laterally, to sort of look at an article and say, who is hosting this article? Let me look at what I know about them. Oh, this is hosted by a crazy group. Maybe I don't even want to read this anymore. So just last week, we have about 25 of our DAs have volunteered to go out in the community and teach this. We had the developer of the program, come from California, do an all-day training for us. We will come out and do this program. It's about a 3-4 session program. And the research they have done shows that going through the program increases somebody's ability to sort out bad news, if you will, by almost 80%.
Okay.
So, and those are also good critical skills, you know, as well in the legislature. You want people to really think critically about who's telling me this, what's the story here.
Right.
This is going to be lifetime learning. So our plan is to spread this across the county. We're also going to start taking it to senior centers, because more and more, especially since the pandemic, we're seeing people who are older, who may be a little bit housebound, who are getting all their information off the internet as well.
Are instances of medical fraud common in Massachusetts, and why do you think that medical professionals who sexually assault patients under false pretenses are currently protected by the law?
So we have had an unfortunate number of cases where someone goes to a medical professional for treatment and is in some way touched inappropriately by that treating person under the belief that it was part of the treatment. So you go to someone, they say, in order to treat whatever it is, I'm going to need to touch here, do this, whatever it is. People want to get better, so they believe that they're being treated by this professional. They know, he or she knows what they're doing, so they allow that touching. Under the present state of the law in Massachusetts, because the patient consented, even though they consented because they thought it was helping them, we cannot prosecute for that sexually inappropriate touching. The Supreme Judicial Court has said consent, no matter how it was obtained, is consent. Mm-hmm. And it has said the legislature has to carve out that exception if that's what they want to do. And that's what this bill would seek to do. It would say that if you give your consent because you believe it to be in the best interest of your health, because you've essentially been tricked,
right,
that's not real consent.
What are the main goals of the Bridge Back Initiative, which is that's a Lowell program?
It's a Lowell program. We've partnered with a number of agencies, including the Bridge Club. And the idea is, you know, many times we want people to be held accountable for their behavior, and whether that's that they're on probation or they're incarcerated, but we want them to have a way forward.
Yep.
And this really looks to, and the biggest issue in all of that is probably getting a job, because you can't get to the next places if you can't make any money.
Right.
So we have worked together to have a group of Corey-friendly employers, people who will employ somebody who's been in custody or has been on probation. And when people are identified to us, whether it's by the probation department, by their lawyer, by themselves, somebody comes in, by a family, that I'm somebody who's got this record that I've developed, but I do want to be working, we can let them apply for those jobs, be interviewed, get that job, hopefully. And an important piece of this is we have the ability to offer some transportation, because we would see sometimes somebody, if they did get a job, was spending their whole paycheck on Ubering back and forth.
Right.
So this addresses a lot of those. The Bridge Club is collecting work-appropriate clothing, for instance.
Right.
So you want to go for an interview, you can go get some clothes over there. They have recovery coaches. If you're struggling with a mental health or a substance issue, you can also be seeing that person and working on those issues. So it's meant to be a wraparound program.
Okay. District Attorney Marian Ryan, thank you very much for being on the show. I have to say, I think you do a great job in your position, and what has amazed me over the years is how many times I see you in Lowell.
I love Lowell.
You're up here as much as, I can't think of a district attorney who's been in Lowell more than you. I'd have to go back to maybe Jim O'Day, who was before my time and who lived in Lowell. But anyways, thank you very much. Thank you.
Take care.
All
Bye-bye.
right, take care. So that ends another edition of the Beacon Hill Buzz. I want to thank everybody for tuning in, and we'll see you next time. Thank you very much.